Then you need to check for response. That is where the hello comes in. You tap the shoulder of the patient, and you speak into the ears of the victim, because we said the sensory nerve is the last organ, or the sensory organ is the last organ to die, the hearing organ. So you scream into the ear of the person. As you are doing that, you are checking for response. You're checking to see if the person will respond in any manner, whether squeezed face, squeezed eyes or something. Then you send for help. You send for help. Also, then you check for the airway. You see if there's any obstruction of the airway. You see if there's any obstruction of the airway. Then you check for breathing. How do you check for breathing? Through the rising and falling of the chest. That is the visible sign if someone is breathing or not. Now, if the person is breathing, you put in a recovery position, so that if the person wants to aspirate anything, it can actually come out through the side instead of going back and blocking the airway. Then if the person is not breathing, then you start CPR. You give 30 chest compressions and 2 breaths. Now we have different ways of which we give compressions for different ages. We have for adults, we have for infants, and we have for children. Now, for adults and children, it's practically almost the same thing. You put your two hands, you put one heel of your hand on the middle of the chest. You locate that middle, that is that triangular part that is underneath the breastbone. You put one heel of your hand there, and then you use the other hand to support the hand, and you press firm. Then you balance yourself, you straighten your elbow, and you fall on your victim. That is how to give compression. And then you start compressing. You compress as deep as 5 centimeter, that's 2 inch. That is, then you start giving your compression. Then for child, you can use just one heel of your hand, or you can also support it with the other hand. Then for infant, you use 2 fingers. Infant, you make use of just 2 fingers when giving compressions, because they have very, very fragile bones. So you use just 2 fingers when giving